Good morning, everyone. Thank you for joining us. A little cooler here than it was yesterday, right, Zach? Yes. Yeah. Did you see anything really special yesterday?
I was pretty impressed with your bank shot.
Yeah. Yeah, nothing but net, Zach, nothing but net. All right, it's how we roll here. That was fun, but a little hotter yesterday than it was today. But I do want to acknowledge some individuals who've joined us here today, starting with our Commissioner of the Department of Labor, Roberta Reardon. Thank you. She travels all over because I just saw her yesterday up Saratoga County. You are extraordinary, and I want to thank you for helping lead one of the initiatives that we're talking about here today. Dr. Guillermo Linares, who's the president of Higher Education Services Corporation. Thank you for what you're doing on the higher education front. Another one of our announcements. Also having assigned member Deborah Glick is always a pleasure. Thank you for your leadership as the higher education chair in the assembly. And we have a special guest, Tiana England, who's part of the city administration for Children's Service, is going to talk about one of our fun initiatives as well. So we're going to be talking about some of the steps we're taking to bolster our healthcare workforce. But as always, we want to give a quick update on monkeypox, COVID, and so let's just get started with that. When it comes to our COVID cases, happiness, you can see there's been a stabilization. Statewide, that's encouraging news. But also, we're going to prepare for the fall. I did an announcement on this several weeks ago. Our fall action plan has getting 3 million test kits into schools, which we think is critically important because every child needs to be in school this fall, and we have to keep them safe. But the experiment of education at home is in the rearview mirror. We don't want to go back to that. We need these kids in school, so we're getting test kits out to them as well. Our PPE stockpile, again, with foreign supply chains that have only worsened since the pandemic, we're also building up our reserves, as well as promoting boosters, vaccines, testing, and treatments. And our cases, again, stabilizing most places, but we continue to monitor. As soon as there's a little shift, we launch into action and find out what's going on there, making sure that people are getting all the supplies of vaccines and booster shots they need. Also, the monkeypox outbreak, as you know, we announced a declaration of emergency, and here's why. We're seeing higher cases. You can see them across the state, about 1,617, growing quickly. And I'll be talking about our vaccination allocation as well. We have 170,000 to date, making sure that we're receiving our fair share. As I mentioned before, this is a conversation I've had with the White House. They originally were allocating based on population. We are not the most populated state, but we are the state with the highest number of cases. So we wanted them to shift how the allocations were going, so that even though there's a limited supply globally. So we're working around the clock to do that, as well as a public education campaign to really talk about the vulnerable communities. Let's get this out there. We're not shying away from this. Dr. Mary Bassett has been doing an incredible job just speaking truth and telling people what behaviors are at risk and being really smart about this. So, but as we said before, about 1 out of 4 cases in this country are in New York State, and with a high concentration in New York City. So, the reason we declared a declaration of emergency, it allows us to respond more quickly. What does that look like? That means when we do have more of a supply of vaccines, which we're anxious to get our hands on, we can have more people allocate them other than just physicians. That allows us to have EMTs and pharmacists and others in the healthcare system, midwives, people who can help administer them. So when you get under a crunch situation, you want to have more people who are eligible to do this. We needed the declaration to do this. Also, we want the providers to send us the vaccine data information, which they weren't required to do before. So working with the White House around the clock as well, Dr. Jha, who we're in regular communication with, other federal officials. We're glad to see that the administration is stepping up. We also have Dr. Dimitri Daskalakis is from New York City. He's on the White House panel, so he is our direct point of contact to make sure we get our share. So we talked about the fact that we'd be soon getting 760,000 more doses, more vaccines. The federal government will be getting that many more, and 110,000 were coming to New York State, 80,000 of which are going to New York City. You can see our allocations thus far, our different tranches. Our last allocation we're waiting to get those out to add to the numbers in New York City as well. New York City gets them directly from the federal government, but in our phase 3, we've allocated over 16,000 statewide. We're going to be doing about another 12,000 more, and I'm allocating an additional $4,000 to the city on top of what they're getting from the federal government. So that's what we're just, we're looking at the disease burden, where it's most concentrated, and we're being really smart about that. So we're confronting this outbreak with the urgency that it requires, our full-on attention, and trying to protect the communities and getting the vaccines out there. But also to do this and to do everything related to COVID and other areas, we need a really strong healthcare workforce, and that's what I want to talk about today. So we're going to be talking about the fact that we all saw during the pandemic that there are individuals who, were on the front lines. We talk about them, we honor them, and it's, not all heroes wear capes. Some of them wear scrubs. We saw that. And these individuals have, it's really taken a toll on their own personal lives. We lost a lot of people who had been healthcare workers, who had trained for this. They were concerned about their own health, their own safety ultimately, but the vast, vast majority did stay. And they're the foundation of our medical system. And they got us through the last 2.5 years. There's no doubt about it. Thank God for them. But it did come at a cost, a physical cost, an emotional cost. And they're overworked and underpaid. And, and they did feel, as time went on and people were not complying with getting vaccinated, they just felt frustrated. I saw that as I toured the state speaking to many nurses. They just didn't understand why people weren't protecting themselves. So they've been through a lot. But even before the pandemic, we saw signs that the need for healthcare workers back in 2018 would grow by 32% over the next few years, between then and 2028, over the next decade. So we saw that coming already. Then you have the pandemic wreaking havoc on the whole ecosystem. And as a result, our hospitals, our nursing homes, our long-term facilities, and even the homes for our loved ones, people work in their homes, there's a severe shortage of workers to go in there. So it's not just a crisis for these workers, it's a crisis for all of us who really need that health care as well. So it's time to start bolstering that workforce. And I committed during my first State of the State address that we would grow our workforce by 20% over the next 5 years. It's ambitious, it's bold, but that's what we do. And we're going to start by making it easier to become a healthcare worker. And easier means relieving the financial crunch that is required to get the education necessary. So today, we're here to announce our 1,000 scholarship winners of our Nurses for the Future program. We invested over $15 million of our COVID money. We had people selected by a lottery. I announced this way back. 63,000 people applied for 1,000 slots. Now, that tells me a few things. There's a lot of interest out there. And so, as we go forth, I'm not making any premature announcements here, but I'm looking at this saying there's demand. People need help to pay for their education. Let's get that done on an ongoing basis. And so we'll be talking to my team about our State of the State addresses. That's for the future. That's for next year. But over 98% of the people who applied were from New York. We wanted to bring people in from other states as well to get them to move here. And over 400 of these winners will be right in the New York City area. So we're going to have scholarships. They're going to be able to have their education, either full-time semesters or part-time equivalent, 2 to 4 year degree at a SUNY or CUNY institution. Got to support our state institutions. And really, when they get their degree, they'll commit to stay with us for over 2 years. And so hopefully they'll build their lives right here in the state of New York. And so that's going to be one element toward a multifaceted approach toward increasing our health care supply. But right now, we have about 9,300 openings for healthcare nurses, healthcare workers across the state, particularly registered nurses. And it's important for us to recruit the next generation of workers. So Tanaya, you're going to be telling us a little bit about what it's like to be part of that workforce team. I know you're going to, but it's not enough just to bring new nurses into the field, which is one strategy. It's also about showing appreciation to those who are already here. They've been through a lot. I don't need to describe it any further than I have. Just walk up and talk to someone and ask them what life has been like since March of 2020. And it's been so hard for them. And they did stay in. We've been hemorrhaging healthcare workers. And now I've talked about this for a long time. We owe them more than just a debt of gratitude. We owe them a way to help pay their debts. And as I said in my State of the State address, we would pay them in bonuses. And so today I'm announcing that we're making good on our promise to launch an online portal for healthcare worker bonuses. This is where employers can claim bonuses for their eligible workers. We have identified who the eligible workers are to make sure that $1.3 billion in funds are allocated to eligible workers who make less than $125,000 and have remained in their positions for at least 6 months. And that will equate to up to $3,000 per worker, because we still have to keep these healthcare workers. They have been enticed to go to other states. They have other traveling nurses opportunities, which are much more lucrative. So just as a sign of our gratitude, but also just to lift their financial burden, we're going to continue those programs as well, and you'll hear about that. So that's just 2 ways we're working to bolster our healthcare workforce. But we're also, as I mentioned during our budget, we're investing over $20 billion in our healthcare industry overall. $2.4 billion for healthcare infrastructure and lab capacity, because it's antiquated, has not been invested in many facilities. You're shaking your head, you know about that as well. Okay. Plus almost $4 billion in aid to hospitals that are struggling from COVID. Remember, their services were shut down. They did not have elective surgeries. They really took a huge financial hit during this, so we have to keep them alive. Having them close is not an option. It's not an option, so we have to help them as well. Plus, increasing the wages for home health care aides who've been underpaid for too long, $7.7 billion to help lift them up by increasing their wages as well. So these are just some of the aspects we presented a few months ago. I just wanted to give you an update on where we are. We're making real progress, and that's how we continue to recruit people, retain our workforce, and make sure that we're there doing much more than just saying thank you for the past. We're also invested in you in the future, and this is what we're excited about. So as long as you show up to your work in New York State, we'll have your backs just like you all have at ours. And so with that, I want to bring up Tanaya England, who, as I mentioned, works for the New York City Administration for Children's Services. And just tell us what it's been like out there, all right? Thank you very much, and I'll be up again shortly.
Okay, so good morning, everyone. I'm very excited, very, very happy to be here. Okay, so thank you, Governor. Thank you so much, first and foremost, for your leadership on behalf of healthcare workers here in New York City and throughout the state. So my name is Tanaya England. I'm excited to be a part of the new program that they have going on, Nurses for Our Future. A little bit about myself. So yes, I'm currently employed under the Clinical Consultation Program for Administrations of Children's Services. So basically what I do there is I help children who are impacted by families who have substance abuse issues, some mental health, and some who are experiencing domestic violence in the home. So I am this is not, This is the idea that I have for giving back. And I just want to be completely honest in everything that I say here. I love to give back to the community. I want to give back to the community. I'm doing it now. I currently hold a degree in social work at CUNY University. And during the pandemic, I experienced so much. I lost my mom. I had a baby. So I got to see firsthand how nurses come in and nurses help the community. They help the people. They make sure that they have everything for us. They play such a crucial role. So the way they help me and put their lives on the line for me, I said I want to give back and do the same. The one thing, that kind of stood in my way was I'm a mom of 2 children. So it's not easy. It's expensive. So thinking about going back to school wasn't the ideal dream for me. But my sister told me about Nurses of the Future, and she said apply. I said, okay, I have nothing to lose, and I went and applied. 2 weeks later, I got a call back stating that I had won the scholarship. This was the biggest dream that I had. I wanted to do it, didn't think I can afford it, but now I have the opportunity to do so. So now I can embark on something that I really wanted to do in life. I can focus on learning. I don't have to focus on the cost or anything, and that means so much to me, and I'm so grateful for that. Because a scholarship won't just help me pursue a career in nursing and my dreams, it's also an advancement to support my family. Governor, thank you so much. I want to say thank you for fighting on behalf of healthcare workers across the state, for investing in us, in our future, and investing in the future of New York. Because of the pandemic, if it's taught us nothing, it's taught us that what we need to invest in is to strengthen our healthcare system. So I'm very excited to start nursing school and to take care of New Yorkers in any way that I can, in a new way. Because even though I'm already doing it, now I get to embark on something that's going to be even greater. So again, thank you so, so very much. And now I want to introduce Assemblywoman to come up and to have a speak. Assemblywoman Glick, thank you so much.
Okay, so now I'm verklempt. That was very moving. I'm just so happy to be here today. Thank you so much, Governor, for having the vision to ensure that we can open the doors to our universities to young people and maybe not so young people who want to give back to their community. We know we need more nurses. Anybody who has ever been in a hospital or had a friend or a family member in a hospital knows absolutely that the nurses mean everything. And it is not just a profession, it's a mission. And people who undertake it are incredibly giving, and we in our state are lucky for those who make that commitment, but we have to make it possible for those who want to be nurses, for them to do so without the barrier and burden of the financial impact on their families. So I'm really thrilled, as Chair of Higher Education, Governor, this has been the best budget for higher education in a decade or more, and so thank you for that. And thank you for this, because I think it sends a signal that New York State is not just committed to health care in its fullest measure, but also that we are committed to ensuring that everyone who wants to participate can have an opportunity. And one thing that the governor hasn't mentioned, and I'm sure is not part of this program, but I personally want to thank you for increasing the Patricia McGee Nurse Educator scholarships, because our nurse educators are aging out. And we need nurse educators, but it is expensive to go through your additional education. And and I think there probably are some nurses who, through the pandemic, are not sure that they have the stamina in their later years to stay on the floor, but still could give back by becoming nurse educators. And that scholarship offers, I think it's $20,000 for nurses who want to continue their education and become nurse educators for future generations of nurses. So this is a great day and a great budget. And in so many ways, Governor, you have set a standard for support for our public education systems, for ensuring that healthcare gets the support that it needs, and sends a signal to young people that New York State believes in them and that they have a place in this state where they can pursue their dreams and ensure that we have a solid healthcare system for all New Yorkers. So I'm grateful to you. I'm happy to be here today. And as I am the closing speaker, I want to just let everyone know that this was a great signal for the future of the state of New York. So thank you very much, and everybody have a great day.